morning to everyone. As we all know nowadays, there are various approaches that can be used in regards of our health and well-being, be it modern or traditional medicine, contemporary medicine, and alternative medicine. There's a variety of choices, you name it, but how much do we know about these approaches? Before that, let me introduce myself and my group mates. I'm Qamarina, and together with us here we have Faiz, Syurina, Jocelyn, and also Nanthana. We are pharmaceutical technology students from School of Pharmacy, MSU. On this bright morning, we are going to know in depth on regards of the famous traditional Chinese medicine, which I think most of us know about it. So first and foremost, joining us today is someone with a very vast knowledge on TCM. Please welcome our special guest, Madam Beck. And hello, Madam. So I hope you've been well. Would you please tell us more about yourself and your experience in this field?
Okay. My name is Madam Bay. Mostly they address me Madam Bay lah. Okay, I'm Bay Chun Hong. Okay, I've been practicing TCM for I think since 2012. That means it's almost 9 years. Okay, but I've been teaching as a part-time lecturer in MSU for 7 years. That means start from 2014. Okay, my clinic is in this Kepong KL.
Okay.
Actually, I only practice for 1 day, which that means Tuesday. Every Tuesday, I will be in Kepong, which the clinic, we have several of TCM practitioners. It's not only me lah. So myself is only Tuesday. Okay, so this is only a brief introduction of myself.
All right. Thank you for the warm introduction from our special guest. Without further ado, let's begin. So, what is exactly TCM? As the name suggests, the practice originated in ancient China and have evolved over time. But how does it differ from the modern medical practice? So, what do you think about this, Madam Beth?
Okay, if you say that TCM, I think most of you all know, which you can search online, that we have several thousand years of what can we say? It actually practice on human life instead of nowadays modern medicine. They doing research mostly on animals. Okay, because it start from ancient. So from ancient, we don't have this kind of privilege to do, what can we say? Experiment. Okay. On animals. So mostly they are using the herbs to test it on human, or they are using some sort like treatment. You can say acupuncture, but previously the acupuncture that they use is like a sharp stone. Okay, so they're using a sharp stone to do treatment, and then starting from there, they start to invert into others sources to be more accurate on the points. So then we have this acupuncture needles. Okay, so this is the what can we say, the dramatic and slowly, actually they are slowly changes over century. Okay, so basically they are based on qi. Ada orang dia tak faham apa itu qi kan. Okay, so qi, tapi for Asian I think they understand. Most of Asian tak kisah you are Malay or Indian or any Asian, they can understand that what is qi. This is a vital energy. But for Western people, they don't really understand, Most of them, they can't accept the vital energy, the qi things. But I think Asians, they can accept. Okay, and basically we are focusing on imbalance. That means your body qi, we divide the big picture is yin and yang. Okay, there's a light side and a dark side. Okay, there's an upside and a down below side. So we call it yin and yang. And then from there, there's an imbalance in yin and yang of your body. Then we basically to balance it up. So there's no such thing like antivirus in TCM. There's no such thing as antibacterial or anti-anything. There's no such thing in anti in TCM because we are not doing anti. We see imbalance, we balance it up. So kalau you more young, panas bara ke, fever ke, then we try to lower down your fever. We have to look for the cause of your fever. Then we try to lower down. Okay, you have too cold, you have too many water. That means water retention edema. Okay, so how to get rid of the water? Just to balance up the body. So basically, this is the modern medicine and TCM. Another thing is about the how we diagnose. Okay, in TCM, we have 4 main inspection. Okay, and we diagnose from the inspection from these 4 methods. But in Western, they are more on lab report. Okay, actually previously I'm practice. That means I'm a qualified laboratory. I'm working in medical laboratory for 12 years. Okay, so basically, for Western, we are more looking at the lab report or ultrasound, X-ray, and everything. But of course, all this they can help us. But other than this, then we have to diagnose basically based on our TCM principle, our TCM theories, instead of using the Western. Okay, so mostly this is the difference between TCM and Western. And then using herbs also, we are using herbs instead of Western. They are more invent on but nowadays they are trying to have more herbs drugs, but previously they are more on chemical substances as a drugs. So in TCM, we are more on herbs, and then the prescription that we prescribe is basically a balanced prescription. Normally, we are not using only one herbs. Mostly, the herb is 2 until like 12 or 15 herbs together. Okay, so all the herbs that we have, who is the general? That means herbs, we have 4 direction. That means the general, they have to, okay, if you are having fever, so the main thing is we have to cool down the fever. So the general herbs will be the cool down the fever herbs. Okay, but other than that, of course, you have other symptoms. Like you're having fever, then you have cold, you have this cough, and then you have this what can we sore throat, all these things, then we have to use other medicine to balance up. Sometimes we use also some sort like a poison medicine, but we have another medicine, and then we only use the benefits of the poison instead of the apa benda yang poison tu yang akan poison kita punya body. So this is how we use and how we invent in TCM.
Okay. So basically,
Okay.
TCM is all about balancing between the good and the bad.
Yeah.
Okay. So let's move on to our next question from Nanthana.
Would a Chinese doctor advise patients to practice Qigong as an aid to improving their energy system?
Okay. Qigong is a prevention method in TCM. Okay. So Qigong although it's been practiced for so many years, that means also it's 1,000 years ago. But basically they are connecting all. That means our body posture movement, breathing, and also including meditation inside Qigong. Okay, so actually we advise patients to do Qigong if they have community of Qigong. Then other than that, we advise to do some more easier exercise like walking, like doing some exercise at the parks. Or nowadays, most of the country is a lockdown, so we advise them to do exercise at home, which you can watch from YouTube, isn't it? I do the same thing also. So but actually, we advise patients to do more movement instead of only Qigong. Okay, but I'm not talking about Qigong is not good. Qigong is very good. Qigong is very good if you have a good teacher. I'm practiced Qigong for so many years, but sometimes I feel that if like us, we are younger, you feel that Qigong is so boring. I don't know you all feel it or not. Previously I'm okay, but after that I feel that is more boring instead of is more energetic for us as a you all are not me, as a teenager. So, but for older people, yes, they feel more comfortable with Qigong instead of they doing hits, gym.
Is
Pardon?
Qigong Tai Chi?
Okay, Qigong, they includes Tai Chi. Tai Chi is one of the Qigong. But other than Tai Chi, nowadays, China, they are more emphasized of 4 types. The 4 types, you can search it online. Actually, if you go in TCM in China, that means degree in TCM in China, they have this Qigong that they need, there's one of the elective subject they have to take. The Qigong they have inside, one is Tai Chi, another one is 八段锦、五禽戏、六字诀、易筋经, 5 Qigong. Actually, they have a book, that they have a textbook on this 5 Qigong. So they have to practice all five of this. Okay, this is in China TCM, but in Malaysia, because we don't have if your community don't have this culture, it's not easy for us to advise the patient. Okay, but if you can do Qigong, it's very good. Yes, because they helps your body posture, movement, and also this improve your breathing. How you control your breathing, and also the meditation to cool down your mind. Nowadays, lagi pun CMCO kan, I think most of us attention with all the online teaching and all these things. Okay, so this is what we advise lah. Basically, we have to look at the age of the patient, the activity that the patient do, and also the environment. Okay, TCM is not only one thing. We have to look at the patient as a whole. Okay, how they connect to the environment and the social economy, all these things. Okay.
All right. So Joe, your question?
All right. Morning, Madam Day. So, so should nursing programs, especially programs offered for nurse practitioners and advanced nursing specialists, should they include TCM as an elective unit?
Nursing. Actually, I feel that it's good. It's good to include as you said, as an elective subject. Some sort like a few elective hours is good. You know why? Because most of a Western, we can say sometimes it's a Western doctor or Western nurses, they are misunderstanding of TCM. Why they have this kind of problem? Because some of the TCM practitioner is not a real TCM practitioner. Okay, so what happened is they do things like so in nature.
Is it like superstitious things?
Extraordinary. like X-Men things of. So we actually TCM is actually a true science. Okay, we are not doing anything other than science in TCM. So is we have our philosophy to follow, we have our theories, we have our treatment, and we have all these method to, we have a standard method to do, to use, to practice. So there's no such thing as uh, in superficial all these things. So so it's good for them to understand our principle and our treatment and the science behind TCM, so that they can recognize the real TCM practitioner, ataupun we call it TCM treatment of method, and they can exclude all the yang tak betul lah. Okay, this is what we advise. Other than that, they also can help themselves. Like you know about qigong things, then if you have time, you can go for a practice or a course with a teacher. Then it's good for your own health, to maintain your own health also. Okay.
All right. Okay. Next is question from Shu.
Okay, my question is, can I take my normal medication while taking TCM?
Okay, can. You can take your normal medicine while taking TCM. Okay, so that means if we are taking Chinese herbs and also the Western medicine, we mostly we advise patient to take it 2 hours in difference. So that it won't crash lah. So this is what we advise, 2 hours in difference.
What if the patients don't follow the instructions?
What kind of effects that would happen?
Mostly, I tell you what, actually, TCM medicine herbs, if you take together with Western, the effect is more good, you know.
Okay.
Most of the time, but we are not advising. Why? Because there's no scientific research behind this.
Okay.
So actually we are not advised, but some of the so-called not real TCM, they always mix the Western medicine with the Chinese herbs. So they call is my herbs, saya punya ubat sangat baik punya tau. You kalau makan tak ada sakit, straight away tak ada sakit. This kind of medicine they mostly they are combining the steroid and also Chinese herb. But what happened is they combine these two, the effect is very good, but there's no science research behind this. So we are not recommended. So mostly we are advised patient to use it differ 2 hours. Whether you take the Western first or you take the Chinese herbs first, the differ is 2 hours.
Alright. Okay. So our last question from Faiz.
As we know, the acupuncture very famous. We have 2 questions. How many acupuncture sessions should I have? And the second question, do I have to choose between conventional medicine and TCM?
Okay. This is a good question. Selalu orang tanya. Okay. Basically, we have to base on what kind of disease the patient have. Okay. Kalau dia kena stroke, let's say. So kalau kena stroke yang beginning yang betul-betul chronic punya keadaan, we are looking for 3 to 5 times acupuncture per week. Okay, so that we can fasten the movement of the whole body. That means kalau tangan dia ke kaki dia ke, we have to fasten the movement. Okay, that one we advise you can do it 2 days once or 1 week 5 times. Okay, biasanya kita tak recommend every day tau. we have to let the body to invert it themselves. Our body have our own recovering system. Okay, so we have time for our body to let it invert it itself. So, oh, okay, I tak ada yang luaran, boleh tak saya overcome my own problem? Okay, and then another thing is also TCM acupuncture, we also can improve our body qi. So once your qi dah improve kan, kalau kita tak buat, boleh tak dia buat sendiri? The qi will going around, or the qi still stagnant there. Okay, so we are not recommend to do it every day. Then we can see how the response of the patient. Okay, this is one thing. So kalau dah recover kan, maybe you do this for 1 month, 2 months, and the patient improve a lot. Then you have to reduce. You don't need to do it 2 days once or 5 days per week. Maybe you only 1 week 2 times or 1 times which is necessary. Okay, kalau macam you kena apa? Let's say you bangun pagi, lepas tu sini dah sakit, tak boleh nak bergerak macam ni. Okay, so this of course one time acupuncture mostly dah boleh recover most of the symptom. So other than that, I will teach you how to do the exercise so that it will improve for the next few days. Okay, so we have to see what kind of disease the patient have. This is one thing. Okay, kalau untuk conventional medicine ataupun kita guna TCM, yang ni kan sangat-sangat penting. Ada orang kan, dia ingat ni TCM like God, you know. Saya tak payah pergi Western dah. Saya kena cancer kan, I tak payah tengok doktor. I terus pergi TCM. No such thing. Why? Because in Malaysia, conventional medicine is still the main medicine that is recognized and by government. Okay, of course, TCM is already been recognized, but it's only complementary as a complementary medicine. So you cannot advise patient to use only TCM instead of conventional. Okay, so they have to go to the true conventional. That means they go through everything. Okay, they have symptom like pain, like muntah, or badan panas, all these things. Of course, they can go for TCM for some medication to reduce the symptom. Yes. Okay, but other than that, we are not recognized straight away use TCM. There's no such thing. Don't recognize patient to do that.
Okay. Okay. So, as you mentioned just now, I heard about cancer. So, can we know a little bit about how TCM is used to maybe alleviate the pain of cancer patients or something that related with cancer?
In TCM, there's no such thing as only one formula. Like now COVID, China dia ada 2 formula yang kata memang boleh cure COVID. There's no such thing actually. There's only some sort like pharmaceutical company or what, they try to invert the medicine, but actually there's no such thing in TCM. If you're talking about cancer kan biasanya what I see lah from cancer patient, biasanya cancer patient lepas buat apa? After the chemo, radiotherapy, they have this symptom, panas sangat, sakit kerongkong. Okay, they have this dryness which they are very difficult for the patient to overcome. Some sort like they cannot eat at all because they asyik muntah, dia makan muntah, minum muntah. Okay, so all this kan, yes, when they come to TCM, we can help to reduce. Sometimes I prescribe a few kinds of medicine. Basically based on dia punya body type. TCM we have this body type. Okay, like you is what kind of body type? The fat people, what they have, what kind of body type they have. Okay, in TCM, we consider a fat person, they have more edema.
Okay.
Instead of what can we say, a slim person. In a slim person, we consider they have more fire in a slim person, mostly, but not necessary. We still have to diagnose first. Okay, this is how we diagnose a TCM cancer patient. Okay.
All right. Okay, although there are various differences such as the principles, treatments, and then when comparing TCM with the modern medicine, TCM also provides us with various advantages when applied to our health and well-being. So thank you very much for lending us your time and also sharing your knowledge and then your experience with us today. So our discussion today has been very beneficial to us and then also has broadened our knowledge and perspectives on TCM. On behalf of my friends and I would like to apologize for any offense or misunderstandings directly or indirectly. And with that, I end our interview today. Thank you and have a nice day.
Hi, good morning.
Morning. Ingat you lecturer tau.
No.
Thank you and have a nice day.
Okay, thank you. Bye.
Thank you.